Okay, I think I'm going to go ahead and get started. It's right at 11 o'clock, and we've got a lot to cover today. So first, my name is Bobby Newman, and I want to welcome everyone to today's National Network of Libraries of Medicine webinar. This particular session is being hosted by the Greater Midwest region as part of our Kernel of Knowledge series. For those of you who aren't familiar with the Greater Midwest region, we're located here at the University of Iowa, hence the kernel of corn in our Kernel of Knowledge series.
About that.
We have an exciting presentation for you today, so I'm going to go ahead and get started to make sure we have time for all the content and questions. Just a few housekeeping items. You are automatically muted on entry, so please use the chat panel to ask questions or make comments. You may need to exit the full screen mode to access that chat box. You'll also notice in your panel you can use the drop-down menu to designate who the chat goes to. Please mark everyone if it's meant for the entire group so everyone can see, or you can send messages directly to me if you're having a technical issue. We will be posting this recording on the National Network of Libraries of Medicine YouTube page for full viewing or reference within a week or so. You want to go ahead and go to the next slide, Danielle? So first, I want to introduce myself to you as today's host. I am Bobby Newman, and I'm the Community Engagement and Outreach Specialist here at the Greater Midwest region. Basically, that means I connect with the public libraries in our 10-state area. We will be offering a 1 CE credit certificate at the end of today's webinar. What's going to happen is at the end of the webinar, I'm going to email out a survey asking you to answer a couple questions about the webinar. And when you get to the end of that, if you want the CE credit, it'll prompt you through the rest of the process. All right, and then I'm going to go ahead and introduce today's presenters. So Erin Donlin is the Information Services Librarian at Gail Borden Public Library District, where she helps library customers find reliable information to answer their health-related questions and represents Gail Borden Public Library at the Kane County Community Health Improvement Plan Executive Committee. We also have Danielle Henson, the Community Engagement Liaison from the Gail Borden Public Library District. Danielle engages to connect the community and the library as they rise to fulfill their GBPDL, that's the Gail Borden Public Library mission, the library where imagination and transformation flourish, fueled by the power of community. She's a library representative to the Activate Elgin Community Health Coalition and committee chair to the Activate Elgin Annual March into Health series, and the Elgin Community Council for Health. Wow, Danielle. Randy Riopel is the director of the City of Elgin Parks and Recreation, and he oversees the facilities, staff, parks, golf courses, and operations. He's the chair of the Active Elgin Citywide Health and Wellness Committee, engaging all sectors of the community to work in harmony, providing all residents with opportunities to improve their health, well-being, and quality of life. And then we have Mary Carol McDonald. She's the manager of Diabetes and Nutrition Services at the Presence St. Joseph Hospital. She received her bachelor's degree in nutrition from the University of Illinois at Urbana-Champaign, and she completed the dietetic internship at Miami Valley Hospital in Dayton, Ohio. She represents the hospital as an executive committee member for Kane County Health Department. Her passion is promoting health and preventing disease through lifestyle change. She has worked as a registered dietitian for over 30 years and is currently the manager of nutrition and diabetes services at the Presence St. Joseph Hospital. And I had the pleasure of seeing this presentation or seeing this group present at the Illinois Library Association conference. And today they're going to talk to you about how they work together for wellness literacy. Take it away, guys.
Thank you, Bobby. This is Danielle Henson talking, and I want to welcome you to the Wellness Literacy Library-led Community Health Initiative. And I'd like to introduce Randy Riopel, who will speak to you a little bit about Activate Elgin and the City of Elgin Parks and Recreation Department and how engaged he is in the community for community health building.
Thank you, Danielle. I think what I'd like to do is start to help introduce our listeners to Elgin and the community we are. Give you a little background since it's people from across the country that are listening in on this. So Elgin is a northwest suburb of Chicago. We're about 50 miles out from Chicago. Population of about 112,000, a very diverse community. Probably over half of our population belong to minority groups. We have a good portion of Elgin that's an older city, dense urban setting. And then we have some other out to the west that's more a suburban feel. But we're a very diverse community. Our tagline is a city in the suburbs. So we feel like we have more in common with probably with cities than we do with suburbs, but we have a little bit of both of those in our community. Our Parks and Recreation Department is a part of the city, and here in Illinois, there's also a lot of communities that are served by park districts that perform a similar function. Wherever you live, there's probably a local park and recreation agency that's a part of your community. And so a lot of the things I'm going to share today can probably be translated to them as well. This first slide shows our Mayor Dave Captain. He's working out with our community at an event that we held several years ago, which was called Elgin's largest family fitness program. And one thing I'd encourage everybody to do is find a community leader that is really concerned about the health and wellness of your community, and get them engaged with your partnership, whatever you're trying to accomplish. Somebody that can kind of be out front for you. And in Elgin, this has been Mayor Campton, who truly is concerned about our residents' health. Our department has 3 areas of strategic focus: conservation, social equity, and health and wellness. And my guess is whatever your recreation agency does, generally speaking, they're going to focus on similar areas. We have a national organization, National Recreation and Park Association, that talks about these 3 pillars, they call them. And I think they're pretty generic throughout the community. So as we talk about potential partners for you to engage, I'd encourage you to check out your local park and rec agency and see if one of their pillars, their areas of strategic focus, is health and wellness. And if that's the case, they would be a real good agency to start with in terms of partnership and engagement for health and wellness initiatives. Here's just some of the examples of some of the organizations that our departments had as health and wellness partners. And a lot of these partnerships go back before Activate Elgin, which I'll talk about a little bit. But you can see we have a hospital, we have a grocery store, we have a university, and a library. So it's kind of a mix of public and private, nonprofit, for-profit partners. And again, as you think about your community and who you can partner about, I'd encourage you to look into these different areas of different types of organizations and just partners and people that are stakeholders in your community. As a city, oftentimes we look at issues in our communities and think that we're the ones that have to solve them, but the reality is many of these issues are way too complex and we don't have the expertise to address them. And so what we've kind of figured out is that there's many organizations in our community that have the resources and expertise and things that are better than ours or different than ours and complementary. So as this slide shows, we've decided and found out the best way to approach these tough issues is not to be the hub, but be one of the spokes. So when it comes to community wellness, our department feels like we're just one of the spokes. And as we talk today, you'll hear from some of the other spokes that have come alongside us to deal with these issues of community health and wellness. And again, as you look in your community, I'd encourage you to look at maybe some non-traditional partners that you hadn't thought about dealing with in the past, or you didn't have something in common. Do a little research and find out who in your community might be concerned about your residents' health and wellness, and reach out to them and ask them if they would be one of the spokes. I want to talk a little bit about Activate Elgin, because that's really how we all came together. And Activate Elgin was created back in 2006. And actually this was led off by our local YMCA. It was their initiative, and it was an offshoot of the Pioneering Healthier Communities initiative, which was a nationwide initiative back in the early 2000s. And in 2006, we created a coalition of organizations, again, many different types of organizations that came together on a regular basis and identified issues, health and wellness issues in the communities, and looked for solutions. And during the startup phase, there were probably about 10 or 11 organizations. And through those years from 2006 to now, many have come and gone, but we're still about the same number, 10, 11 organizations. And that seems to be a good number to get a good cross-section of community and a manageable size and a good number of stakeholders to kind of deal with the issues you identify. This next slide just shows some of the logos of the partners that are currently engaged. And again, this is something that kind of changes from year to year and even throughout the course of the year. As we get into some of our events and activities, some of those are attractive to other organizations and businesses in the school, and that's when some of them will come aboard for a while, depending on what we have going on at that time and place and how relevant it is their mission or their business organization. So early on with Activate Elgin, one of the things that we got involved with and really helped us a lot was grant giving. We were fortunate enough, one of our real good partners has been Kane County Health Department. And back in the early startup dates, probably 2008, we received a $40,000 grant from them. And we in turn turned around and gave out 35 mini grants to, there was businesses, there was faith-based organizations, there was different neighborhood groups, there was schools that were involved. And we gave the grants out for a short-term wellness project, and it was great because we're able to multiply our efforts. We identified some great stakeholders and future partners for that process, and it was a great way for us to get introduced in the community. As you form these coalitions, your group becomes much better positioned to get those types of grants. The people that are giving these grants out there looking for communities that have engaged stakeholders, not just one organization, but multiple organizations. So your organization right now may not qualify for a grant, but once you start one of these coalitions, that coalition may, and you can get it accomplished the same through that coalition, the same things. Talk about some more initiatives that have been associated with Activate Elgin through the years. As I mentioned, our mayor is very involved with it. We have a program that's called Walk with the Mayor. Typically starts the end of May and runs to September. And for the most part, every other Wednesday, we have a neighborhood walk. We move that all around our community. It's a way for us to encourage people to get out and walk. It's a way for people to meet their neighbors. Often they don't get to meet their neighbors. People just don't get out and visit with people like they used to. And so it gives a format for that. It's a way for our city to talk to residents about their concerns and for our stakeholders to introduce their programs and services to residents as they go on these walks. We also have a Mayor's Walking Challenge that happens in June, where we challenge different groups to form teams and walk in a challenging format. And that's another similar activity that we're reaching out to the community, trying to engage them in the healthy exercise of walking, but also just to make community connectors and to make our community a better place to live and work. But through the years, what's kind of surfaced as our flagship event is March into Health, and here's some pictures and slides from some back March into Health events. March into Health's been around since 2013, and I'm not going to talk a whole lot about that because Danielle Hansen, who chairs that, heads that up, she's done a wonderful job with that, is going to get into more details about that. But we kind of look at that as a way to kick off the health year for our organization and just a way to reach out to the public and kind of set the table, not only for all of those events, but also for the events through the course of the year.
Thank you, Randy. We're going to introduce Mary Carroll now to talk about Presence Health.
Hello, this is Mary Carroll. As Danielle said, I represent Presence St. Joseph Hospital. And when I'm out in the community doing wellness and prevention activities, a lot of people ask, why is a hospital interested in wellness and prevention? Isn't a hospital just a place where you go when you are sick? And while that's true, we have a lot of sick people that come to the hospital. Hospitals, especially not-for-profit hospitals, should be very vested in maintaining good health in their communities. I'm going to share with you the mission, vision, and values of Presence Health. I won't take the time to read each of those statements to you, but I've underlined some of the key words that represent our dedication to improving the health of our community. You'll note that our mission is not to do open heart surgery or to draw your blood or to set your broken bones, but you'll see on the slide a lot of emphasis on the word communities, on partnership, on collaboration, respect, serving the poor and serving the vulnerable, to demonstrate our commitment to the community to not only treat the injured and the ill, but to maintain the health of the entire community. All not-for-profit hospitals, in order to maintain their tax-exempt status, are actually required to provide benefit to the community that they serve, and that's above and beyond the treatment for the ill and the injured. We use a lot of acronyms in healthcare, so you'll see the CHNA on the screen, and you're going to hear me say the China, and I'm referring to the Community Health needs assessment. As we're looking to provide benefit to the community we served, it's not just about thinking, oh, let's go do a blood pressure screening here, or let's do a grocery store tour at that store. We take time to assess what are the healthcare needs in our community, and then plan our services and our programming around that. And that assessment of our community health needs is done also as a partnership. It's conducted by the 5 hospitals in our county, which is Kane County, a few other community partners in collaboration with the Kane County Health Department. So we do this about every 4 years or so, and you'll see a picture of our last report. Then my next acronym is CHIP, our Community Health Improvement Plan. So once we conduct our CHINA, our Community Health Needs Assessment, we take time to analyze all of the data that we've collected to identify what our Community Health Improvement Plan should be, or our CHIP. The Community Health Improvement Plan brings together over 60 organizations in Kane County, including libraries, working together to analyze the data and to creating what we find from the data to be our priority areas. So our current Community Health Improvement Plan identified our areas of focus as chronic disease, behavioral health, and income and education. So I'm going to take a minute now to share with you our objectives under each of those 3 categories, and then what some of the initiatives that we are working on, especially things that we partnered with our libraries to do. So for our first initiative, chronic disease, we've got several sets of objectives and goals there, but highlighting, we've broken down how can we address chronic disease in our community, breaking that down to focusing on the fruit and vegetable consumption of the adults in our county. Our goal that we increase the number of people that are eating 5 or more servings of fruits and vegetables, and that we're decreasing the number of people who report to us that they don't have any leisure time, physical activity as part of their daily lifestyle. And then some of the initiatives that we've put into place to help us to achieve these goals are partnering with local markets to provide fresh fruit at programs. You heard Randy mention the Fresh Market in Elgin, one of our local grocery stores. And here's a picture of a representative from that market at one of our March into Health events, where they brought a boatload of fresh apples, oranges, bananas, all kinds of things, so that all the participants who were attending got to have a nice healthy piece of fruit at that program. We've also hosted gardening programs with our cooperative extension, garden clubs, or nurseries to help people to identify, regardless of their living situation, if they've got a backyard where they can plant a garden plot, or if they live in an apartment and have a balcony and can just put a pot with some herbs in it on their balcony, how they can participate in gardening. Libraries can display their exercise DVDs or exercise downloads so that residents are aware of what they can check out from their library to help them to exercise, especially if they don't have access to a fitness center. Walking Book Club has been a great initiative at the Gail Borden Library, where a group comes together and takes a walk and discusses a book that they've all read in common. So they're not only getting the stimulation of sharing the book, but a little physical activity as well. And then consider hosting a cooking demonstration with either a local chef, a dietitian, a home economics teacher. We've even had a chef from our local school district as part of March into Health events do programming along with us. So lots and lots of things that you can do, especially partnering with your libraries to address chronic disease in your community. Our next area of focus from the Community Health Improvement Plan was improving mental health in our community. So our goals there were to make the adults in our community more aware of the mental health resources that are available. And some of the initiatives that we have in place to do that include partnering with your local park district or other providers who offer meditation, yoga classes, or chair massages. A lot of these people are happy to come out and do these kind of things for free because it's actually really good marketing for the providers and so forth. And if it's an enjoyable experience for the people that come, it might be a new client for some of those folks. Partnering with local hospitals or other agencies to offer depression screenings. There's actually a National Depression Screening Day that you can use as an opportunity to offer these screenings. The library might be able to have a brochure rack holding information on the resources that are available for behavioral health issues in your particular community. And the picture on the right is actually a labyrinth that is at Presence St. Joseph Hospital. Just last year, we partnered with the Gail Borden Library and a local minister to do a program as part of March into Health to educate people on how to use a labyrinth. Now, if you aren't fortunate enough to have a brick outdoor labyrinth like we do, there are finger labyrinths that you can download from the internet. So it could be as simple as that to help people use that as a resource for stress management and so forth. And March into Health is always in March. So unfortunately, one of the few times that we had snow in our area last March was when we did our labyrinth program. So thank goodness for the finger labyrinths because that pulled us through the program. Then our last area of focus is on income and education. And our goal here may sound strange to you when we're talking about, improving the health of our community, but our goal to address income and education is to improve the four-year graduation rate in the public school districts in our county. And the reason that we identified that, if you think about kind of a chain of events here, when people are not graduating from high school, their likelihood of getting a good job decreases. If they're not getting a good job, their likelihood of obtaining health insurance probably decreases. And without health insurance, then their opportunities to participate in, in seeing their healthcare provider and getting good health is affected as well. So starting with graduation from high school, that can ultimately affect the health of that individual or their future family. So a few of our initiatives to address income and education in our community are really partnering with local high schools, identifying student book clubs, homework help hotlines, student advisory boards for the library, bringing in students and getting their opinions on what their peers are looking for in the public library. I know this is second one is one that my kids in high school had on library setup day, or I'm sorry, at the locker setup day at both middle schools and high schools. The library was present to share the services that they have to help students to be successful in high school, offering ACT and SAT prep classes and practice tests to the local teenagers. What's not on the slide, but is helpful to the parents too, if you're a parent of a college student, you probably know about the FAFSA and the challenges that families sometimes have in understanding and completing the FAFSA to get financial aid for college. So that's a resource that could also be helpful to parents. Hosting a career day or a job fair at the local library, partnering with the school librarians to help bridge services during weekends or on school holidays. I know, again, my local library had copies of all the textbooks that the kids needed. So when it was, 8 o'clock at night and the kids realized that they forgot to bring a book home that they needed, we were running over to the library to get access to that book. So that was a real help. And then finally hosting English as a second language classes or programs. If you're in a diverse community like ours, that can be very helpful. So lots and lots of resources and ways that healthcare providers and libraries and recreation facilities can all work together to improve the health of their communities.
Thank you, Mary Carol. Now we're going to hear from Erin Donlan from Gail Borden Library.
Thank you. The Gail Borden Public Library District serves over 144,000 residents. It covers not just Elgin, but also South Elgin and some parts of some neighboring cities as well. The mission of the Gail Borden Public Library is to be the library where imagination and transformation flourish, fueled by the power of community. We strive to be a good partner with other organizations because we can accomplish so much more in our community with our partners than we ever could alone. I represent the library on the county's Community Health Improvement Plan that Mary Carol just talked about. We were invited to join the executive committee because we were already involved with other committees with the health department. We had already been making a conscious effort to embed ourselves in the community. The goal of the Community Health Improvement Plan are to improve some specific health measures in the county. What that really means is we want X number of people in the community to make changes in their behavior. As we know, it's mid-January. A lot of people have already broken their New Year's resolutions. Change can be really hard. So part of the way the library can support the goals in the plan is just to provide our residents with opportunities to support and make those changes. We can do that in passive ways by putting up book displays on weight loss or brochures for agencies. And sometimes we're just one more voice in the community. We can be one more place where people are hearing about how they can improve their health. Sometimes we can be more active, like the programming Danielle will talk about. And we also can support individuals who have decided to make changes by connecting them with information and referrals. Health literacy is important in any community. Health information can be really confusing, even for people who are highly educated, and it's harder for those who aren't. Many people have difficulty understanding health information because they don't always have the background knowledge they need to understand what their doctor is telling them. If they've reached a point where they have a health problem, they might be feeling really stressed or overwhelmed. Of course, librarians aren't medical professionals, so we can't help them interpret what their doctor has said. But we can evaluate how well they're understanding their situation and try to provide them with materials at the right level. We then always encourage them to discuss what they've read with their medical professional. Navigating the healthcare system can be pretty complex, and it's a lot harder for people who are struggling to read or don't know where to go for help. Like all libraries, we're in the business of improving literacy in the community. In our strategic plan, one of our priorities is to focus on 21st century literacies, which include not just basic literacy, but also learning how to evaluate information, how to use technology, and health literacy in general. As we saw, increased income and education levels are correlated with better health outcomes, which is why the CHIP plan has income and education as one of its priorities. I'm on that committee, and we've been working to identify all the groups in our community who are providing programs that help people in these areas. Often there are small groups that are working independently, which can make it hard for people to find the right help for them. So if we can bridge those gaps, sometimes we can just do a better job of referring people. At the reference desk, we respond to health questions in a variety of ways. We typically have people who walk in with questions, but we also offer one-on-one appointments. Sometimes people have a specific question and we can help them research the answer. Sometimes they don't want to share and we'll just ask a vague question about where the health area is. We do try to do a reference interview when possible, but if not, we'll give them a short tour of the area so they can find what they want after we leave. We always refer them to additional sources of information like library databases and websites like Medline Plus. When it's appropriate, we refer them to health resources in the area, but we also have those brochures out in a display so people can take them without having to talk to us if they're not comfortable. If you're not comfortable evaluating health information or doing health reference interviews, there are some really good opportunities for professional development. I've taken courses through NNLM, and I also recommend looking into the Consumer Health Information Specialization through the Medical Library Association. Now, we know, of course, that a lot of people aren't coming to the library to ask a librarian about their health question. Often people go straight online to learn about their health. They can find some really good information there, but it's often mixed up with information that's not so helpful. Some of it may be out of date, biased, or just untrue. The library can help people evaluate those websites, and we can recommend sources that are reliable and trustworthy, but not if we're not talking to them. So we have to look for opportunities to promote those services. And that's where partnering and programs come in, and Danielle will tell you more about that now.
Thank you, Erin. So what can libraries bring to the table to support community-wide health programming? What are our strengths? Book lists, databases, resource lists, links, our IT and access departments that help with programs, online entry forms that help us with Marching to Health, programming, compilation, and keeping things organized for me, technology and room setups, community development, and your youth departments. Also host programs and partner with partner programs. We have a lot of people coming to the library to present programs that are in our community, so we don't have to develop programming. A lot of times we are supporting programs that are coming to us if it fits with what our mission and our vision is and what we can do. Creative services or your marketing department can design the marketing. They design, creative services designs our brochure and posters for library programs, whether we're sponsoring them or our partners are sponsoring them and they're hosting them in the library. How can we? Understanding partner strengths is very important. In our group, Activate Elgin, we have a fiduciary, we have a partner that does in-kind, we have partners that do in-kind help, like brochure printing, 5,000 copies of the brochure. Kane County Health Department does that. We have translation, people who do translation, planning, different aspects of planning on the Marching to Health Committee, outreach to businesses, professional speakers or presenters that are in our community that we can tap and host at our library. Also, we want to think about volunteers and the creative use of volunteers if you are able. Some libraries aren't able to access volunteers directly, but if you can, think about creative uses. We have an amazing amount of talented people in our community, and they want to help libraries in different ways. They want to use their skills and their abilities and the things that they enjoy doing. So shelving books, not so much. Planning a program, face painting, presenting a program, this is what they're interested in. So think about developing maybe volunteer job descriptions that fit your volunteers and fit the needs that you have for your library. This in the picture is Joan and Joanne. They help me plan programs for Marching to Health and other events that we host at the library. So they are people that always sit at the table, greet people, make sure that people are checked in when they are coming for organizational tables or speakers. So there's ways people can support you in the ways you want to reach out for the kind of programming that this is. This is our kickoff event last year. Actually, the picture on the left is Ralph of Ralph's World. That was part of a program that we did 2 years ago. And then on your right is last year's Marching to Health cover of the brochure, where we had the American Ninja Warriors Also on the front, you'll see we have grand prizes for the series. All of our partners come together to present programming throughout the community. And this is the front of the brochure. We have hosted the March into Health kickoffs at the library, and that kicks off all the series throughout the month. We have chef demos and tastings. We have fresh fruit from the local grocery shops you heard, organizational tables, prize drawings for the event, and prize entry for the grand prize drawing at each event. That starts with the March into Health kickoff. Last year, we had the Ninja Warriors. They did an interactive program. This year we'll have a program called a group called Circus Steam come out, and they are an interactive circus program. So they're going to be interacting with families. They're going to be juggling fruit in the rotunda and the lobby around the area before the main event happens. We always have a bike and prize packages. You can probably see that later on the slides where it talks about golf, swim packages, fitness packages. And these are in-kind donations and partnerships with businesses and our partner organizations. So every year we have about 20 to 30 events, and we try to make sure that these programs reach all demographics and all parts of our community. We want to make sure that we are giving everybody an opportunity to come out. The brochure goes into the Gail Borden newsletter that goes out to 55,000 homes in our district, paid for by the Activate Elgin group. So we come together, we raise the funds, and this is not out of the library's pocket. The library donates staff time, and then also creative services and programming rooms. So you don't have to have a financial burden if you move into a project like this. You'll see that there's a Spanish language on the right-hand side in the green box. Elgin, like Randy said, is about 47% Latino, and we want to engage and make sure that we are programming to all of our community in the way that they would like to be communicated to. We work hard to have a variety of programs that reach community with health and wellness opportunities. And I'm just going to go over a couple things that we're planning for this March that I got in. We're just compiling that now. And we have an eco-healthy RACO Kids, so that'll be at our branch, our RACO branch. We have Kickstart Your Garden, food and fitness concerns at Present St. Joe's. Randy's hosting a U46 program here on nutrition and have it's a no school day, so that'll be interesting. We have warm composting for families, healthy travels, and lunch and learn. And this will feature, this will be at the Senior Services Center, but it'll be a Gail Borden program from our Tales and Travels outreach group that focuses on memory issues and programming to people with dementia. And they're going to Greece, the birthplace of the Olympics, and they're going to highlight some different things and do a little exercise with the seniors. We have a grow your own salad. We have a walk and hop to Seba Park. I mean, these are things that, aren't going to cost your programmers or your library a lot of money. Certainly these are things that you can do. You can do craft things. So again, you can take a look at this later, the full program description from last year. And you can check out Activate Elgin's Facebook page when we have the brochure for this year if you're interested. So engaging partners is a lot of fun. Partners surprise you with the fun programs and things that they bring. Last year, School District U46 came to the library and did a overall wellness and nutrition program, and they brought the wheel of nutrition and hand washing stations. And so all ages came, and they had a good time. They had prizes. They walked away with snacks. And then they also brought this banana that walked around the library and greeted people and brought them to the program. So, you just never know. We always have surprises with partners and their creative ability to design programming that's fun and interesting for the community. On your left, that's Dr. Sweat, and he's at a school and he's doing a program with kids. Dr. Sweat is from the Center of Elgin, Randy's domain, and I think that he's going to do another program this year. So we were really excited about how he engages all ages. I think he's doing one for all ages this year about chair exercising. And then Mary Carroll, you'll see on the right, she is at one of our March into Health programs. Looks like that's 2 years ago from the brochure I see on the table. And she's engaging, we have tables all around the lobby. So probably about 20 tables of partner and sponsor organizations. And it's just a really good opportunity for families to engage directly with the organizations that have important health information for them. This is a senior program that we did here at the center. We partnered, Gail Borden partnered with the center to do the film screening of The Age of Champions. And this is about the Senior Olympics. And this is the seniors doing a little bit of exercise before the film. In fact, they had exercise and then they had a lunch. And after that, we met one of the people who attended the program actually had an Olympic medal. And so his daughter brought him. He wasn't able to talk a lot about what he had accomplished, but he was so excited to share that medal. So it's really interesting who you're engaging in your community. And then on the left is another program we had at the library that focused on, this is a professor that focused on health and wellness as you're aging. These are our big winners. We have had grand prizes of We Fit, and then we've had grand prizes of bikes. So we have gone out and partnered with community businesses who sell bikes, and they're really excited to partner with us to get people interested in biking. We have a lot of bike. We're on the river. You heard the train. We have train tracks. We have a river. We have a bike path. We have a lot of, Randy oversees a huge Parks and Rec department area, a lot of parks, walking paths, the libraries on the river, right on the walking path. So we want to get people engaged and interested in getting on the walking paths and engaging on the bike trails. And this is a really good way to do it. And on your right is our last year's winner, Steve. And on his shirt, it's talking about worm composting. He's actually going to be a presenter this year at the library as a volunteer. He's going to present Worm Kings, and so engaging families in worm composting. And so you never know who you're going to find in your community with this kind of programming, who's going to come back and want to do something to give back to your efforts. So it's pretty exciting. And on the back of our brochure is always a shout out to our tremendous sponsors. Even though some of them change from time to time, we always get exciting support. And we want to make sure that people know as they move forward after March what is happening. So the mayor, we put the Mayor's Walk on the back with the dates. We put the Mayor's Walking Challenge. We usually have a challenge. Randy talked about, and then the King County 1 Billion Steps Challenge. So throughout the spring and summer, there's more opportunities for people to engage online or at events for health and wellness throughout the community. We also have the Facebook page, so if you want to check that out, we post a lot of things on there. So as a library, this looks a little overwhelming, but don't be overwhelmed. This project started several years ago, and it has grown. We started with, I think, 10 programs. It was a one-pager, started out really slow, started to find our talent in programming for health and come up with creative ideas, engaged more partners. People actually, once you start a series like this or you start programming for health, either during a certain month or during a week. I know Naperville did something that was interesting around wellness and health and financial wellness. So that was, you might want to look that up. And I think that was just a week or two. So it doesn't have to be a month long. You can create whatever you'd like to create, but find out who your partners are, who are your natural partners. Building partnerships for programming takes time, and there's bumps, there's adjustments that you have to consider. But when you're done, you're going to create a really nice program series for your community, or programming for your community, because you're going to have real solid partners who are invested and are doing their part to make it successful. So who are your partners for health? And just a little bit of a summary about identifying literacy and health needs of your community, understanding your own mission, vision, strengths, what your resources are as far as building programming like this, understanding what your partner's missions and strengths are, and where you can weave those together. Of course, I don't know if you can see on your screen, but it's a little blurred out. It says where do your missions intersect, and find out what your strengths, what your natural strengths are, and who your community partners, what their strengths are. What can you build together that promotes a literate and healthy community? So sometimes it's just sitting around a table having conversation, inviting people to a meeting. We have a lot of meetings at our library. We have all kinds of subcommittees. I'm sure everybody else does too. So, what does a health subcommittee look like? What does a community health committee look like? Is there already one in your community that maybe you're not aware of, or you haven't thought, hey, I could be part of this? How does it fit? I think we've shared a little bit about how it might fit for you, how you can get there. And then I think we're gonna look for some healthy questions. So if you wanna come back on, Bobby.
Yeah, I'm here. So great job, guys. Thank you. I am just so impressed with the community partnership that you guys have put together, and how involved everyone is in this partnership. So hopefully everybody got some really great ideas. I tried to tweet some things out as fast as I could type. I do have a couple questions from the chat box. I'll go ahead and read. I think the obvious one is, will the slide deck be available after this presentation? Is that something you'd be willing to share with me and I can email out?
Absolutely.
Okay, great. So what will happen is within the next day or so, I'll send out an email that includes this PowerPoint deck along with a link to the survey about the webinar. And again, that also contains the CE certificate. So keep your eyes peeled for that. Any other questions from attendees? Maybe while they're typing or thinking, maybe each one of you could tell me what your personal favorite program was.
My personal favorite programs are the kickoff, because it brings all of our efforts together. Our partners and sponsors get to see the people that come through the door who are engaged. Typically, we have 200 to 350 people come through the door. It depends on usually the weather. So we're hoping for a bigger turnout this year. We can fit about 235 people in our community rooms for the main event on stage. But we like to have some time ahead of time for the organizations to kind of share. We have the roaming juggler and a lot of activity and some food tasting, sampling, and really gets people excited. They want to put their name in for the drawings, and I think that's my favorite event.
And for me, a similar type of thing. The first picture that was showing the mayor out front with that group, that was one of our kickoff weekends too. That was at the center of Elgin, and had a couple hundred people in there. And again, Dr. Swett was leading us, and the mayor got up there, and the mayor showed up. I didn't understand the mayor was going to get up there with Ron. So he showed up in his sweatshirt and his jeans and his tennis shoes on and started exercising with Ron. And all of a sudden I look at the mayor, and the mayor is really starting to sweat. Like he had his shirt on and his sweatshirt, and he's hanging in there, and Ron's going, and I'm just off to the left of the mayor in that picture. You couldn't see me, and I'm trying to signal to Ron to wind it down because I'm concerned for the mayor. At that time, he was about 65, 66 years old, sweating like crazy. And Ron is getting into it, and the people are getting into it, and I've got to try to get this thing toned down. So I guess that was one of my favorite one, although I had a little bit of concern for the mayor's health at that point in time. But fortunately, nothing happened. The mayor's in good shape. He worked out well. But that's out of all of these events, the one that pops in my memory most.
This is Mary Carroll. I'd probably throw out there some of our walking challenges. That's kind of a different venue because it's not come at this date, at this time, to this place, but something that encourages activity, whenever you can fit it into your day, and is sustained because the challenges are usually at least a month long. The American Public Health Association Billion Step March, I think it is, that we participate in as a county is actually several months long. So that's one that encourages movement when you can do it and for a sustained period of time.
I know one that's coming up that I'm kind of excited about is a health app. So a program that one of our librarians, Monica Dombrowski, is going to lead, that walks people through all the health apps. So that's another way that libraries can support things, is getting people information about digital options and how do you navigate the health app world.
Great. Okay, go ahead.
Yeah, the technology part I think is really important, and you just heard two examples of that. And we're really concerned that activate elderly about the obesity rate among children. And children, less and less want to be active, but more and more they want to be involved in technology. So it's kind of like if we move to that format and we have things like Mary Carroll said, the Mayor's Walk-in Challenge, we push that out through a technology platform out there, Walker Trackers who we use, and some of these other apps are just informing them. That way we feel like we can draw them back into being active through technology. So that's a nice way to use the latest and greatest in technology to get these kids moving.
Okay, I want to get to a couple questions from our attendees. So one of the first ones is, do any of you offer specific classes by library staff on health resources or evaluating health information on the web?
We've occasionally done specific classes. We find that sometimes it's easier to partner with something else that's going on and add that health literacy, information literacy piece to it, because a lot of times people aren't going to come just for that one thing, but if they're already there, we can catch a lot more people that way. So
yeah.
Try to combine it with other activities that are going on.
And I seem to hear that a lot from public libraries when I get out and talk to them, that the class specific on it sometimes doesn't do very well.
Yeah, sometimes people want that information when they have the information need. Right. So they're not necessarily planning ahead, oh, I'm going to take a class on this because some point in the future I'm probably going to want to learn about it. It typically, when they have a question, is when they want to learn how to research it.
And the next question I see is, how enthusiastic have individual community members been? What programs have been the most successful and or well attended?
Boy, that's a hard question. We have about 2,000 to 3,000 people that enter our drawings, so it's hard to know. I know Mary Carroll, one of our 2016 winner, 2016 winner, actually was very excited. She had gone to 3 different events, and she continued her program with Mary Carroll. She was in a class with Mary Carroll at the hospital. So I believe she came with her kids and her family. So also Elgin is made up of a lot of young families, up and coming families. And you'll see a lot of family programming in the March into Health, and we have to be very thoughtful about making sure we're programming to seniors, making sure we have something for teens, making sure everybody has, because most people want to put on family programs because that's what Elgin is.
Yeah, if they're family oriented, that's going to bring bigger numbers. And I think the prizes we give, the incentive, we're incentivizing people to come out to these things. I think that's an important part of it. And I know Danielle and her committee works real hard to get those prizes donated. You know, each and every one of these individual 20 to 25 events, at the end of that event, there's a prize that's given out. So we know that's a part of it. You know, we feel like we have to do that to incentivize people to come out and do that. I think that probably some of the biggest ones we've ever had were some of those family group fitness programs. I know we've done some walking programs that were pretty popular. But I think it's going to vary in communities. Every community is different, so what works for you is probably going to be a little bit different than works for us, but there's going to be a lot in common too between those types of programs.
Our senior programs are pretty well attended. Our children's planting programs are always booked. So if you have a local farmer that you want to engage with, maybe a farmer's market, you can connect with somebody who might want to come and do a planting program. There's health fairs there this year. I think they're going to have the Jump Rope Warrior at the Gail Borden Health Fair that Julianne is putting on. And that's another place where people can engage community organizations, learn about health information, and then have like a mini program with a presenter. Anything you can do to get people excited about coming. Programming is hard in general. You never know what program's going to go. Something you think is going to go isn't well attended. I'm very surprised. All this, the weather in Chicago area is a big factor, but also people's time. You know, the time frame that you present something. You know, can you get people there in the afternoon? Do you have to do it in the evening? We've had to work out the March into Health kickoff for timing for organizations and then for presenters and when we think people will show up and come out on a Saturday or a Wednesday or Thursday night. The Zumba programs, the interactive Zumba programs that the Y puts on. We have another one that's going to be going at the Epic Air Trampoline Park. They're a sponsor this year. So they're going to have a free program at their trampoline park, and they're going to have a Zumba instructor there and prizes. So, you know, I'm pretty sure that'll be a good turnout.
Great, thank you. We have a couple of questions about the Billion Step Challenge. Somebody's asking, can you repeat the organization that sponsors that challenge, the name of the organization?
Yeah, that's the American Public Health Association. So their abbreviation is APHA.
Okay.
And that is going on right now. Anyone can join it. So if you go to their website, they're using the platform called StrideKick. And that's also a website, stridekick.com. And you could go to that website and then look up the team for the American Public Health Association. But that started January 1st and it goes into April, and anyone across the country is welcome to join. You can also create a team for your community. So we have a Kane Health Counts team representing residents of Kane County here in Illinois.
Great, thank you. And I think that answers Noah's question as well. One last question from the chat is if you guys have done any programming or outreach to address opioid issues in your community?
There's a separate coalition called the Coalition for a Safe and Healthy Elgin, and the library has been engaged with that group, and they are the one, and we also have a very strong partnership with the Elgin Police Department, and those are the organizations that we partner with to tackle those kind of topics. They have the professionals in their arena to talk about the opioid addiction, violence, gangs, any of those things. So if you can find a coalition, if you can partner with your police department, talk with the chief. Elgin has an amazing outreach group in the command staff, Commander Anna Lally, who works with us on all kinds of programming. She does films, moderates films for me on incarceration, and just Not in Our Town Films is a series that we do with them. So that if you go to NIAT.org, you can access all kinds of free films. Contact your police department, because these are topics that they would have connections with. Also, maybe your hospitals, yeah. Depending, but I think it's your social service organizations that focus on addiction.
All right, great. We're right at 12:01, and that's it. We're going to go ahead and wrap up. I want to thank Danielle and Aaron and Mary Carol and Randy for being with us today and sharing about your wonderful community program. And thanks to everyone who is on the line. If you have any questions or concerns after this webinar, please feel free to send me an email.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.